So, do you need to see an epileptologist if you are worried about a seizure? Because most people don't have access to an epileptologist. So, just seeing a pediatric neurologist, because you did pediatric neurology and then you got 2 years of specialized training to diagnose and treat epilepsy and seizures. Is it enough to see a pediatric neurologist and just trust their judgment, follow their recommendations, or everyone who is worried about their kid having a seizure or worried about recurrent seizures or epilepsy needs to be seen by an epileptologist at least once to make sure that nothing serious is being missed, like a genetic disorder or some kind of unusual deficiencies?
I would definitely go to an epilepsy doctor. For example, if you live in an area where pediatric epilepsy specialist is not available, then you may do a regular follow up with your local pediatric neurologist. But then, if the pediatric epilepsy doctor is available to you, maybe 4 hour drive or 3 hour drives, I would do that maybe once in a 6 month. And then I would build like a strong communication between epilepsy doctor, epileptologist with the pediatric neurologist, so that you can get the care, like local care from your pediatric neurologist,
Yeah.
because it's a
Uh,
specialized training and it needs like a special fellowship.
yeah.
So there is a
Yeah.
chance that our general pediatric neurologist, they may miss some stuff.
They may miss some things important.